Diagnosis for lupus. Lupus is a very difficult disease to diagnose. It's difficult because its symptoms can be very vague, and unlike other diseases, it cannot be diagnosed with a single lab test. It has to be done with certain criteria, clinical criteria that are met. Lab tests can help confirm a diagnosis of lupus. Blood work and other tests can also help monitor the disease and show the effects of treatment. The main blood test that they use for lupus is called antinuclear antibody. It's called ANA. It is the blood tests they use along with other physical tests. ANA is present in nearly everybody with active lupus. Doctors often use the ANA test as a screening tool, plus looks at the patterns of antibodies can sometimes help the doctors determine the specific disease a person has. Cause of lupus are hormones, genetics, and environment. Researchers have looked at the relationship between estrogen and lupus. That's why they say 90% of women have lupus more than men. Genetics, researchers have identified more than 50 genes which they associate with lupus. They are seen in lupus more than other diseases. It can develop in people with no family history, but they say it's likely to be other autoimmune diseases in the family members. People of African, Asian, Hispanic, Latino, Native American, Native Hawaiian, and Pacific Island descent have a greater risk developing lupus than Caucasian people. Environment, ultraviolet rays from the sun / the fluorescent light bulbs, sulfa drugs, infection, colds or illnesses, being exhausted, emotional stress, and anything else that causes stress to the body, such as surgery, physical harm, injury, pregnancy, or giving birth, are environmental causes of lupus. Treatment for lupus. Treatment for lupus is with a healthcare team that will tailor treatment to the specific conditions. A rheumatologist, a doctor who specializes in diseases of joints and muscles, generally treat people with lupus. If it is causing other organs damage, you will have to see those specialists like the heart doctor, the kidney doctor, wherever it's having issues, because a rheumatologist is the one that deals with the joints and muscles. At this time, there is no cure for lupus, but people live a pretty long, good life. Treatment goals for lupus. Once it is diagnosed, a treatment plan will be developed based on the person's age, symptoms, general health, and lifestyle. First, they want to reduce inflammation. Second, suppress the overactive immune system. Then prevent flares, treat when they occur, control systems like joint pain and fatigue, and try and minimize damage to the organs.